You need to pump and pace 100 beats per minute.
Okay, that's hard to keep track. How many is that per hour? I will divide and then count to it.
Okay, well, a good trick is to hum to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, I do. I love that song. First I was afraid, I was petrified.
Staying alive, staying alive.
You were in the parking lot tonight. That's how I know you. Staying alive, staying alive. Staying alive, staying alive.
So the scene I just showed you is a funny scene from the show Office, and they're pretty much trying to learn CPR. And so today I want to talk to you about the importance of CPR and the benefits that you can get from knowing CPR. So CPR stands for cardiopulmonary resuscitation. And here in America, I think a lot of people think knowing CPR isn't really that important or relevant to them because they feel like they're not going to use it, and they feel like there won't be really opportunities for them to really need it. But the truth is that here in America, the #1 cause of death is heart disease. And in a heart disease emergency, 70% of Americans feel helpless because they don't know how to give CPR. So today I'm going to talk to you guys about why you should learn CPR, who you can help with CPR, and the steps of CPR. So why should you learn CPR? Like I said before, heart disease is the #1 killer in America, and about 300,000 people each year die from heart disease. One cause from heart disease is heart attack. And when someone gets a heart attack, they usually require immediate medical attention. So you would usually call the ambulance or the hospital, 911. And during that time, when the ambulance is coming to the person, there's a period of time where that person isn't receiving medical attention. And it's important that you know CPR, so during that time, you can increase their chance of survival. So performing CPR on someone that has had a heart attack will buy time for that heart attack victim. It'll increase the chance of resuscitation. It'll keep the blood oxygenated, and it keeps the blood flowing through to the heart, to the brain, and other important organs. Another result of heart disease is cardiac arrest. Cardiac arrest is when your heart stops beating, so blood stops flowing to the brain and other internal organs. Similar to heart attack, knowing CPR for a cardiac arrest victim will increase their chance of survival. And the thing with cardiac arrest is that 80% of it actually occurs at home, so knowing CPR can actually help save the loved one, a family member, or even a friend. And CPR can increase the survival rate 2 to 3 times for a cardiac arrest victim. But the surprising thing is that even though it has such a high increase of survival through CPR, only 32% of cardiac arrest victims actually receive CPR because a lot of people don't know how to do CPR. So now that you know the importance of CPR, I want to talk to you guys about the actual steps of CPR. The first step is to check the person's, to see if they're conscious or unconscious. And then after doing that, you want to call 911 and ask for medical attention. After that, to actually perform CPR, you want to place the heel of your palm on the center of the person's chest, and you want to put the other hand on top of that and link your fingers, like in this picture. You want to keep your elbow straight, and you want to push hard at a rate of 100 compressions a minute. If you don't have any formal training in CPR, you want to continue to do this until medical help arrives or if the person regains consciousness. But if you do have CPR training, you want to do 30 compressions and perform what's called, or you want to tilt the person's head back, kind of like the picture, and you want to check if they have regular breathing. If you're not breathing regularly, you want to do what's called mouth-to-mouth, which is shown in this picture, and you want to give them 2 deep breaths, and you want to see their chest rise and then go back down. And after giving mouth-to-mouth, you want to go back to doing chest compressions. And giving CPR to a child or an infant is very similar, except for these 2 steps. If you want to give CPR to a small child, you want to use 1 hand instead of 2 hands, and for a baby, you want to use 2 fingers instead of your hands. So the worst thing you can do during a cardiac arrest is to do nothing. Studies show that if you actually do only chest compressions, you have a higher chance of saving their life instead of just doing nothing and just kind of like freaking out. So today I talked to you guys about the main points. I talked to you guys about the importance of CPR, who you can save if you do CPR, and the steps of CPR. And you guys seen, I showed you guys like how it's important. So I want to encourage you guys to learn CPR, and if you guys aren't certified, to get certified. Thank you.
Image mute. Okay, well, the video clip goes on for a long time, but it is funny and it identifies the topic that you're getting into. So we'll cut you a little bit of slack on that, I guess. There needs to be, basically, it sounds like your thesis has 2 parts to it, or that is basically the structure, the preview of the body of the speech. It sounded more like it was a purpose statement because it didn't really think that the supporting points fit those 2 things that you were talking about, so you need a little bit stronger preview. The content that you have is pretty good. All the points fit together. You do a nice job justifying the subject, so content issues are fine for the amount of time that you have. Body movement, look, you stand in the one spot, you never move from that spot, which seems to suggest a lot of confidence, but it also suggests that you're a little bit disengaged from the audience. So I think maybe you need to loosen up a little bit. Your gestures are very limited because you basically have the cards in both of your hands most of the time that you're speaking. I think you do look at the audience pretty regularly. Your facial expressions need to be a little bit more animated, a little bit broader. The planning on the visuals was fine. The notes were okay. Like I said, they do kind of limit your gestures, and you do have to look down frequently, although I think you do make an attempt to try and look at the audience somewhat regularly. Your voice, you've got a good voice to listen to. I think you've got some advantages there, but you need to get a little bit more out of it by using some variety in the volume and in your inflection and pitch, because I think it seems to be all at sort of a similar sort of level the whole time, and you need to emphasize a few points or make something light or different or something energetic, or something is sad at some point or other, and you're kind of in a very narrow range there. So although I think that for the most part your voice is pretty effective, you need to work with it a little bit more to get more out of what you've got going on there. All right, thank you.